Out from that now on to this story for this morning. The purpose of the lockdown was to delay the spread of the virus and prevent a surge in infections. On the 1st of May, South Africa moved to alert level 4. A phased easing of the national lockdown began in line with government's risk-adjusted strategy. Given the daily figures of new infections, deaths and recoveries, how will the further easing of the lockdown impact on new infections? Let's get some answers from Professor Salim Abdool Karim. He joins us now via Skype. A very good morning to you, Professor. You're the chairperson of the Ministerial Advisory Committee on COVID-19. Now, Minister Motshekga last night was saying that most of the decisions taken came out of these consultations. Take us through some of those conversations that reassured the minister that it was the right time for kids to go back to school.
Sure. The Department of Basic Education had approached the National Department of Health, and we had, as the Ministerial Advisory Committee, were part and parcel of assisting the National Department of Health in understanding and grappling with what the challenges are going to be and what the risk mitigation strategies need to be. And I think the key pieces of information that we gathered by looking at all of the published literature and the available evidence is that when children are in school, they have certain advantages, including school meals, their intellectual growth, and so on. But the issue became, can they do so in a way that minimizes their risk of acquiring and spreading the coronavirus when in school? And the answer to that is yes, that is possible. We have a range of prevention strategies that's part of the coronavirus prevention toolbox that, if implemented correctly, can reduce the risk of the coronavirus spreading in schools. It does not eliminate it, but it will reduce it to a point that it would be relatively safe for children to go back to school.
As we approach the 500,000 mark in terms of the testing, is it a case of a glass half full or a glass half empty, especially if you consider the numbers of the South African population?
Well, when I look at the overall trends in the epidemic, what we have seen and what we expected to see is that we expect to see the number of new infections to steadily increase. With the easing of the restrictions and the movement of people to a greater extent, we will expect more transmission to occur. But the question is, how do we try to mitigate that effect? And we can do so in multiple ways. By ensuring that where we have risk situations, that we implement our prevention measures. For example, if we're going to go shopping, we want to make sure that there is adequate social distancing at the entrance. We want to make sure that people are hand sanitized before they enter. We want to ensure that somebody has a mask before they enter a shop. Because if we don't implement those procedures, then what we're going to see is small outbreaks occurring. In many ways, in the Western Cape, what we have seen over the last 2 to 3 weeks are small outbreaks, and they've occurred mainly in places like grocery stores and supermarkets where people have been going in during the lockdown. So in those instances, there are ways in which we can mitigate, and we better understand how to mitigate those risks. And I have to explain that in the field of COVID-19, evidence becomes available all the time. And so every passing day gives us a little bit more information so that we can better plan, we can better understand how to slow the transmission of the virus.
Absolutely. But is there even a conversation about testing in schools?
There is very little benefit to simply going around testing people who do not have symptoms. We do not, have a test that remains positive for a long time. The current test we use, called polymerase chain reaction, or PCR, it's a little swab that you put in your nose and we look for the virus's nucleic acid. That test is positive only for a short while. So it's only positive for something like 2 to 3 weeks after a person becomes infected. So if a person does not have symptoms and you do a swab and it comes back negative, it doesn't help you. It doesn't tell you what the situation is. So we only swab people when they have symptoms and they have an index of suspicion. So I think testing should be a very limited strategy. It is part and parcel of the toolbox, but it is a limited strategy directed to those who have symptoms. In the rest of the schooling situation, what is going to be key are the institution of procedures that involve, for example, symptom screening for teachers before they come to school. So anyone who's sick, rather go and have a swab, don't come into school. Children, when they come in, similarly, that they have social distancing to the extent that it's possible. The World Health Organization has given us guidelines on that, and we need to implement the hand sanitizing and the other procedures that will help us mitigate that risk. I have to say that with all of that, we must still expect that there will be small outbreaks occurring in schools. Our plan must be, and currently is in process, is to be able to identify those and to deal with that. That means if we see a situation where we're getting cases, we've got to go in, identify the source, identify how it's transmitting, stop that, and then children can continue schooling in a relatively safe environment.
Prof, I know you're not a political commentator, but Helen Zille says that, and we've seen that the numbers coming out of the Western Cape are the highest in the country. Yesterday, recording at 61.19%, I think, of the country spread. Helen Zille says the Western Cape states are the only states that can be trusted. Their health infrastructure is as ready as possible. Also, her party asserting that the upward trajectory in the Western Cape is largely a consequence of the smart testing, asserting that, are these assertions true that the Western Cape has better testing and health facilities in response to COVID-19?
There are many reasons why a particular part of the country may have more infections than another. It's not necessarily simply one question. When we look at the situation, it's about what were the original risk factors and who is getting infected and how they are becoming infected. If we understand that, then it's less about blaming or assigning any particular single factor, but rather understanding how all of these have come together to make the situation that we see now in the Western Cape.
Prof, one of the big stories today, the South African COVID-19 Modelling Consortium report that the Minister released yesterday, very topical, the predictions they make, about 40,000 to 48,000 deaths predicted by November. These are very scary numbers. Can you unpack these revelations from this report for us?
Yes, I'm not a mathematical modeler, so I work more with the actual epidemiological data. But the mathematical modelers have provided us with some guidance about what they anticipate the situation may look like. Now, that situation is not cast in stone. We can change that. And the opportunity to have a different future lies in all of our hands. The more we abide by the prevention tools that we have available, the less likely it is that we will see such a dire prediction come true. The less each of us abides with the rules, that prediction may prove to actually be an underestimate. So I think you need to look at these kinds of estimates as a potential benchmark. and that our goal must be to do everything in our power, to use all of the scientific evidence that we have, and to find a way to try and ensure that those kinds of dire scenarios are not realized, and that we are able to do better than that.
One of the, and I'm going to be political again, one of the first reported victims of COVID-19 in the country, the Reverend Kenneth Meshwe of the African Christian Democratic Party, coming out to question the reliability of current testing in South Africa, claiming that his results were cooked to drive a message to black people. What do you have to say to such assertions by politicians?
I think many opinions are voiced, and that's people are entitled to. The reality of the situation is that in South Africa, we started testing slowly, more slowly than we would have liked. But what we have witnessed over the past several weeks is that the testing has gone up dramatically. We have been almost doubling the number of tests being undertaken week by week. There are consequences to that, and one of the key consequences is the ability to ensure that we have a supply chain that can provide that rapidly increasing number of tests. And we've learned that with the disruption in international travel, that maintaining supply chain has been a challenge. And so our capacity to undertake tests is now not influenced by the machines and the people that we have, because we have a capacity that exists. Our problem is now ensuring we get the reagents and we get the kits, particularly the extraction kits for the PCR. So as we do that, as we rectify these challenges, and we're not unique. Everyone in the world is trying to buy and get those same kits that we're trying to get. And so there will be these challenges. The extent to which we can circumvent them, the extent to which we can deal with them, will reflect our ability to increase testing in a continual way. I have to say that when I look at the way in which our testing has increased, it is quite impressive. If we look at the second and probably an important measure is how many tests do we do in order to get one positive. Well, if we look at that in the country as a whole, we see that the proportion of tests that are positive is relatively low at this stage in our hospitals. It's also low in some of our screening programs, but right now when we look at our hospitals, we're still seeing a pretty low level. So this just tells us that we have some time. It's no basis for complacency. If we let our guard down, that we will find very quickly that this virus will start spreading and spreading quite rapidly.
So you were saying earlier that you're not a mathematical modeler, but another conversation that came up during this week was that statement by the Academy of Science of South Africa, ASAF, where they were advocating for more capabilities and more skills to come into these COVID-19 Command Council conversations and not necessarily restricted to epidemiology or politics or government only. What are your thoughts about these demands that they're tabling?
I think when we look at this disease, we have a very clear sense of how little we understand and how much we understand. There are many factors that are involved in understanding this disease. There are many disciplines that all can contribute in a very constructive way. I think the extent to which we can harness that, the extent to which we can bring all of those to the table, and in the extent to which we can hear those voices is quite important. The mechanism to do that might vary, and whether there needs to be bigger committees or more committees, or whether there need to be committees at all, that's a logistical issue. But for me, voices that are legitimately trying to give us constructive advice and try to map and guide and support and advance our understanding of this virus and provide us with better options for the way forward, all deserve to be heard.
You don't think it's that old case of too many cooks spoil the broth?
You know, I've been in universities for the last 40 years. And in universities, we know very well in academia, everyone has their own views, and they're very important. It's really important that people have their views and that those views are heard. But some way or the other, somebody's got to take all of those views and make some decisions about what the best way is forward. But that perspective of how to move forward benefits, even to a small extent, from having heard the various viewpoints.
Professor Karim, please stay with us. We're going to take a break now as we say goodbye to our SABC2 viewers. If you'd like to continue with this conversation, stay with us on SABC News Channel 404. Let's take a break.